All right. ChatGPT just released a new API endpoint where you can use their real-time voice chat. So I wanted to do a test here and try and figure out if I could build essentially a voice chat that is a call center agent for a health insurance company. So I built a quick demo app here using the new API that lets you do real-time voice chat. And what I did here is I gave it all of the information about all of the individual and family health plans that Independence Blue Cross sells here in Philadelphia. I don't have any affiliation with Independence Blue Cross, but this is the one I get lots of questions from my neighbors of which Independence Blue Cross plan should I pick for me and my family. And a lot of people know I work in health insurance technology, so they ask me these questions quite a bit. So I wanted to see if I could have a ChatGPT real-time voice agent that answers any of their questions. So let's see how it works. Hey, how's it going?
Hey, thanks for calling Independence Blue Cross. How can I help you today?
Yeah, I'm comparing plans on the website and I want to get a plan that I can use with an HSA. Can you tell me which plan I can use with an HSA?
Sure, I can help with that. For 2025, the plans that are compatible with a health savings account, HSA, are typically labeled as such. From our list, the Personal Choice EPO Bronze Reserve plan is marked as HSA compatible. This plan generally has a higher deductible.
Got it. Yeah, see that one is a $7,450 deductible. Why can't I have an HSA with the Personal Choice EPO catastrophic plan?
The Personal Choice EPO Catastrophic Plan isn't compatible with a health savings account, HSA, because HSAs are typically paired with high deductible health plans that meet specific criteria set by the IRS.
Got it. So what criteria doesn't this catastrophic plan meet?
That's a great question. The Personal Choice EPO Catastrophic Plan doesn't qualify for HSA compatibility because typically catastrophic plans have higher deductibles than the maximum allowed for HSA eligible plans, and they often cover fewer services before the deductible.
Oh, so,
To an HSA, the plan needs to meet specific requirements set by the IRS, including having a minimum deductible and limiting the coverage of certain services before the deductible is met.
so this plan covers too many services before the deductible is met. Is that what's going on here?
That's right.
Okay, got it. All right. Just backing up a bit, I guess. So my family has two young kids, and we're expecting to have a lot of sick visits next year. Based on that, what is really the best plan to select for my kids if I know I'm going to have a lot of sick visits?
For families with young children who expect to have a lot of sick visits, you might want to consider a plan with lower copays for primary care physician, PCP
Which
visits.
one is that? Which one has the lowest copays for my kids' sick visits?
For the lowest copays for sick visits, you'd want to look at the plans with lower copays for primary care physician PCP visits. In the gold category, for example, the Personal Choice PPO Gold Preferred Plan has a $15 copay for PCP visits, which could be quite cost effective for frequent doctor visits. In the silver category, the Keystone HMO Silver Proactive Plan has a $40 copay for Tier 1 PCP visits, which is also a reasonable option.
Got
Just
it, got it. Yeah, okay, that makes sense. I'll look into that. And then I see a lot of these have tier one, tier two, tier three. Can you explain to me what that is?
absolutely. In plans like the Keystone HMO Proactive, the tiered network refers to different levels of providers and facilities. Here's a quick breakdown. Tier 1. This tier usually includes preferred providers and hospitals that offer the lowest cost sharing for members, like lower copays and coinsurance. Tier 2. This middle tier includes more providers and hospitals, but comes with moderate cost sharing amounts. Tier 3. This tier generally has the highest cost sharing for members, with higher copays and coinsurance rates.
Got it. So these are all in network. And then is so there's tier one, tier two, tier three. So I have to look at the provider directory to see what tier my doctors are in. And then there's also separate out of network coverage. Is that a correct understanding?
Right. For the plans with tiered networks, like the proactive plans, you're right that you'll need to check the provider directory to see which tier your doctor is in. The tier of your provider will determine your cost-sharing amounts like copays or coinsurance. However, these tiered network plans typically don't have separate out-of-network coverage. This means you need to use the in-network providers to
Oh,
get.
got it. So if I want to go see a provider that's truly out, then I probably need to look at a PPO plan. Is that a correct understanding? Got
If
it. Okay, and then I'm looking at the personal choice PPO bronze plan, and I see that it says 50% no deductible under the primary care physician visits. Can you explain how that works?
in the personal choice PPO bronze plan, when it says 50% no deductible for primary care physician PCP visits, it means that you'll pay 50% of the cost of the visit. However, you don't need to meet your deductible first before the plan starts sharing the cost with you.
Oh, got it. So I can be sick, go see my PCP, and then I still just have to pay for 50% of that visit. That's correct understanding? Okay,
With the
got it. And then I saw separately for specialist visits on that plan that it's 50% after deductible. So those specialist visits, is it a correct understanding that it won't cover anything for specialist visits until I hit my deductible? Got it.
For
All
specialist
right, I'm all
visits,
set. Thanks for your help today. Appreciate it.
if you have any more questions, feel free to reach out.
I'm gonna stop the chat. Okay, so you can see it's pretty good. I essentially gave it that all that data on that web page. You can see here I created a guide for call center agents. It has, you can see in the guide I'm giving ChatGPT, it has all of the data across all the different tiers, copays, coinsurance, deductibles, whatnot. And I also kind of told how to act as a call center agent. So you can see I gave it as 120 lines of text, a lot of tables and whatnot. I gave it a good amount of data, and it's able to quickly do recall and all that. So it's pretty good. Um, I think it's a tiny bit awkward to talk to, but it's so close to being a real call center agent. I think it's just almost ready for prime time. I did have to customize a few things in the API. So I did sometimes the when I was testing it out, it would wait for me and I would ask a question and it would just keep waiting for me to say more when I was done speaking. So I increased the eagerness level. I thought this was really interesting that the default eagerness of the responsiveness of the chatbot didn't work. So I had to increase that. But other than, I gave it a bunch of custom instructions on the tone to use, be professional, but friendly and not too don't use too much healthcare jargon. So I gave it a lot of input like that. But with this relatively minimal configuration of the API, I was able to essentially create a call center agent for Independence Blue Cross to answer these common questions I get from my neighbors all the time around which plan covers what. So I thought this was super cool to have a voice agent that does all this. And I don't think this year that any major health insurance company is going to have a voice agent answer the phone when you call 1-800 Independence Blue Cross, but I think it's coming extremely soon. And I'm actually curious maybe if brokers will pick it up and say and just have instead of having a broker answer all of these repetitive questions, I'm sure they have to answer what's a deductible, what's a copay, what's out of pocket maximum. I'm sure they answer them questions all day. Why not just have ChatGPT equipped with all of the plan information for this year's plans answer those questions? So that's what I'm excited to build. It's coming very soon. So this is getting very real. AI is here.